guys, welcome back to my channel. Today I'm going to be discussing and talking about how you can decide whether dentistry is right for you. Being in year 12, 13, or if you're in Scotland, being in 5th or 6th year and deciding what you want to do in life is a really big decision, especially if you're wanting to study either dentistry or medicine. If you are wanting to apply for dentistry but you've not, for some reason, gained enough experience, enough shadowing experience, you don't know enough about the subject, then this video is for you. Hi guys, welcome back to my channel. My name is Hannah and I am a 3rd year dental student. I just thought that I would give my opinion as to what dental school is really like, what studying dentistry is like, the pros and the cons of doing so that you can decide for yourself if it's for you. I'm going to be discussing pros and cons so you can really watch this video, break it down and think in your own time, is this degree right for me? Because let's face it, you're in it, it's a commitment. Once you're in, you're fully in, and it's 5 years at uni. You need to give it time and effort. You cannot go into dentistry with a half-hearted approach. You definitely need to be prepared to work hard, to study hard, and as long as you have those traits, of staying motivated, of, you know, always wanting to push yourself, then you should be okay. But this is the reason that I'm making this video, so that you can decide for yourself if it is for you. So let's get started. So the number one reason for wanting to do anything in healthcare is, of course, to help people. Whether that be dentistry, medicine, pharmacy, nursing, whatever it might be, all of these things have one common thing, and usually the people who apply to these courses or do these kinds of jobs like to help people. They enjoy doing this. With dentistry specifically, because that's what I want to be talking about in this video, you will be increasing people's confidence, you will be improving their smile, you will be doing aesthetic jobs, you know, to help them with their appearance, to help them with their confidence, like I just mentioned. But you will also be doing standard procedures, for example, fillings, for example, root canals. There's so many different things that you can do in dentistry and it's very varied. You may relieve a patient's pain, you may improve their smile and therefore improve their confidence. In doing so, in helping these patients, you will essentially feel a great sense of satisfaction within yourself. So therefore dentistry is incredibly rewarding, and for any of you guys who enjoy working towards a goal and you enjoy helping people, this is definitely for you. So that is by far the biggest pro of doing anything in healthcare, especially dentistry. As a general dental practitioner, you are qualified to do maybe around 90% of all your treatments, which means you don't have to refer every single patient that you see, because you are qualified yourself to do most treatments on any individual, which also means that you get to see a patient from start to finish. So this is why dentistry is really good. You get to see their journey from start to finish and you get to treat most of it yourself. Honestly, I cannot wait for that day that the patient just gets the mirror, looks at their teeth, whatever I've done in their mouth, whether that be composite bonding, veneers, whitening, whatever it might be, filling, anything. They look in the mirror and they go, like that. And then I say, you know, it's all me. No. You know, doctors in the hospital, they only play a small amount in the overall picture. They have a lot of varied different jobs with different patients, but I wouldn't say that they have that journey. From start to finish with the patient as much as dentists do. If you are an individual who really likes creative things, then dentistry is definitely for you. If you enjoy art, dentistry. If you enjoy art and science, it's done. Dentistry is the one that you should choose. I was about to do something related to art, but then I also realised, no, I actually really enjoy science as well. That's how dentistry started, because I mixed my science and my art, two things I enjoyed. I honestly do not regret choosing dentistry over medicine. Honestly, I really don't. It's brilliant. I love dentistry. Dentistry also really keeps you on your toes. It's ever evolving. Things are always changing, like new regulations, new research papers coming out. This ensures that your skills are always evolving and improving too. Lots of people that have reached out to me are concerned that dentistry is boring. No two patients, no two teeth, no two treatment plans are ever going to be the same. You're always going to be doing different things with different individuals, which never, by the way, makes it boring. Which brings me on to the point of having loads of different fields in dentistry. Dentistry is made up of loads of different parts. Okay, so there is oral surgery, max fax, endodontics, pediatrics, orthodontics, What else have I not mentioned? Maxillofacial surgery, but I'm pretty sure that you need a medicine degree as well as a dentistry degree to do that one. Prosthodontics, removable and fixed prosthodontics, which are my favourite ones. I really like fixed, which opens up so many opportunities, and that is amazing because it allows you to really think freely about what you would enjoy and what kind of area you want to work in. As a general dentist, if you've been in it for 1 or 2 years, you will not just be doing fillings all day, every day. It will not be that boring and mundane, trust me. So when you start to make dentistry work for you after your training year, you can structure your day so that you are doing specific things at specific times. So dentistry is very flexible. For example, after school hours, you could be doing pediatric dentistry. You could be doing fillings and kind of everyday tasks in the morning, and then in the afternoon you could be doing aesthetic work, that kind of thing. So you can structure your day however you like. There's a lot of freedom and there's a lot of flexibility in dentistry, which is one thing that I really like about it as well. You could see 20 patients, but each patient might need a different thing. One might need a crown, one might need a bridge, one might need a filling, okay? So there's a lot of variation. Dentistry is also self-employed. So you can work 9 to 5, 5 days a week, or you can work 9 to 5, 2 days a week. It's up to you. It's really flexible, and you can honestly make it your own, which means that you've got a really amazing work-life balance. If you're interested in something businessy but also healthcare related, then dentistry is definitely for you. You can own your own business, which I think is amazing, and you can create your own brand within that business. Another fab thing about dentistry is there will always be someone who needs a dentist at one point in their life. You will always need to go to a dentist, okay? So there's always going to be that job security. At uni, especially with dentistry, there are so many different ways that you learn dentistry. It's not just sitting in a lecture hall and listening to some old person talk about teeth, no. You have lectures, which are fun, by the way. You also have labs, you have simulators, you have clinics. There are so many different things that allow you to learn in the best possible way. I would definitely recommend dentistry to whoever is thinking, between medicine and dentistry, or whoever is just not sure about whether dentistry is right for them. Yeah, it's very sociable. You get to chat to your friends, have a bit of fun, but also doing the work that you need to do in the phantom heads. It's just really fun. It's a good environment to be in, and again, since it's practically based, I just feel as if the learning process is a lot more efficient. Okay, now that we've gone through the pros, let's go through the cons, shall we? I don't really like this part, but I need to also discuss the cons so my video doesn't look completely biased, because obviously I love dentistry, everyone knows I love it. So let's discuss the cons. So one point of dentistry that isn't so good is that it is quite a stressful career. You are responsible for all of your patients all the time, so it can be relatively stressful. The pressure, delivering the best care that you can, it can get really stressful and overwhelming. When you get to university, because you've not done anything dental related in your life, you can get thrown into the deep end. You can feel like you are thrown into the deep end initially, but over time, as you make it part of your daily routine and as you make it part of your university lifestyle, it does become second nature. There is a bit of a steep learning curve when you initially join dentistry because no one's really done it before. Yes, you can be good with people. Yes, you can have certain artistic skills, but you've not really combined that with doing certain things in the mouth. When you're working on certain teeth or trying to work on a certain cusp of a certain tooth, it can be quite tricky. So dentistry is also one of those degrees, it's similar to medicine, it's not easy at all. You will most likely have to go in every single day if you are at university studying it. You might have the weekend off if you're studying in the UK. Here, for example, we have the weekend off. I'm in Europe, so our Mondays to Fridays, they're pretty packed. You also need to be prepared to put in quite a lot of your own work. You can't just rely on the course to teach you everything. You also need to do a lot of self-study in dentistry, but that is expected, especially for harder courses like dentistry and medicine. So with dentistry, as you probably know, the workload can get pretty intense at times. The workload can really rack up, especially if you have subjects that are quite similar but also very different in some ways. So for example, fixed prosthodontics and removable prosthodontics. They are both very similar in certain ways, but there's also very distinct differences. especially when talking about indications and contraindications of certain treatments. But in my opinion, it's definitely worth it, because when you study dentistry, regardless of where you study it, you will probably find that your dentistry year group is like a big family. You all do support each other. There's a lot more support that I've seen within a dentistry year group as opposed to a medicine year group. I might be wrong, but I think the dental students stick together, you know. So obviously this is going to be a slightly biased video because I am studying dentistry myself and I do have a passion for dentistry as well. I do feel as if I mentioned the pros and cons in this video, so I hope that you found it helpful. If you have any questions regarding this topic, then I am so happy to answer any questions that you have. You can comment in the comment section below, and you can also reach out to me on Instagram as well. So my Instagram is Hannah J Cooper with 3 N's. Don't ask me why I put 3 N's, honestly. Thank you so much for watching this video, guys. If you liked it, please give it a like and subscribe as well to my channel if you've not already done so. And if you know anyone who isn't sure about studying dentistry, or they're not sure about what they want to do, but you know that they might have these attributes, you know, of being artistic, enjoying helping people, then please send this video to them. It may be useful to them. I hope it is. And I will see you in the next video. Thank you so much for watching, guys. Bye!